Hi everyone, I'm Duyen, and I'm sure you know who this is, right? This is Dr. 𝐃𝐢𝐫𝐞𝐜 from Viet Plastic Surgery Hospital. Last time we discussed and shared a vast amount of knowledge about breast augmentation. And like I promised you last time, for this second live stream, me and Dr. Trai will discuss and share with everyone about modern rhinoplasty methods and how you can have a graceful and sophisticated nose.
Hi everyone! So, today, Duyen and I will discuss rhinoplasty methods for this livestream. There are currently many rhinoplasty methods that are divided into two types, non-surgical rhinoplasty and surgical rhinoplasty. For non-surgical rhinoplasty, the most popular method is using filler. Talking about filler, it's a substance for augmentation, and which types of noses will fillers be used for? It's limited to the noses that already had nice nasal tips. For people who already have long or high nasal tips, this filler will only help raise the nasal bridge, not make it higher or longer.
Yes, and as you may have known, we will have to subtopics in this session, like Dr. Trai just shared, in order to have a beautiful nose. You can intervene with cosmetic surgery methods using silicone nasal implant or natural cartilage extracted from our ears. Aside from those methods, we will have another one, which is using fillers, right? Before diving deeper into these two issues, I would like to share that in today's live stream, Dr. Trai and Viet Plastic Surgery Hospital will give away 5 special discounts that are worth 10 million VND each. With each discount, you are allowed to use your preferred services at Viet Plastic Surgery Hospital. Here is how to win these prizes. Please like and share this live stream, and comment your favorite random 2-digit number in the comments section, as well as tag 5 of your friends. At the end of this live stream, Dr. Trai will select the 5 luckiest 2-digit numbers to win the 10 million Vietnamese dong-worthy prizes. Doctor, I believe that we should return to the main topic of this live stream. And do you know that aside from being well known for breast augmentation, Viet Plastic Surgery Hospital is also very famous for rhinoplasty. So Dr. Trai, can you please share to everyone the available rhinoplasty methods?
The rhinoplasty methods, as I mentioned, are divided into surgical and non-surgical methods. The non-surgical rhinoplasty method uses fillers. On the other hand, there are 3 surgical rhinoplasty methods. The first is Korean rhinoplasty, which is simply using a silicone nasal implant and placing it into our natural one. Why do people call it a Korean nose implant? Because you put a silicone nasal implant, and what are the drawbacks? It will make the nasal bridge below become prominent, sharp, and gradually protrude outward. Therefore, the second method tried to fix the drawbacks of the first one.
After a while, I noticed that for some girls, there will be nasal tip perforation, in which they have to undergo a revision rhinoplasty after 2 to 3 years.
It will gradually lead to nasal tip perforation due to the excessively thin nasal skin. In these cases, people will try to minimize it by taking ear cartilage and wrapping it around the silicone implant, which is cartilage wrapping to minimize. That, in general, both methods will enhance an adequate length for the nasal tip. In cases where the client's noses have an approximately short nasal tip and flat nasal bridge, both methods will extend the bridge to an adequate length, but are incapable of raising the nasal tip. For those cases, the most suitable and effective method is structural rhinoplasty. The procedure involves taking the ear cartilage combined with internal septal cartilage or rib cartilage to raise the entire nose.
Which means we still use silicone implants like these?
Only for the upper part.
Yes, but we will also use ear cartilage to wrap the nasal bridge.
What you mentioned is cartilage wrapping. This is the third method, which is structural rhinoplasty. For those with very short noses, we will place the silicone implant for the nasal bridge. And for the nasal tip, people will raise it with autologous cartilage.
All the cartilage will be taken from the ear, right?
Ear and internal septal cartilage or rib cartilage. For those having a weak septum, we have to take the rib cartilage. So therefore, structural rhinoplasty is the most effective method. When the nose is too short, we will use diced cartilage. Glue graft, which serves as the main pillar for the nose, which is wonderful.
But regardless which method we choose, silicone implant is still a crucial part.
For the previous two methods, silicone implant serves as the main component. The difference between cartilage wrapping and structural rhinoplasty is the length of the autologous cartilage.
Yes.
Well, there are three surgical methods in general.
And among them, can you please share which method's results can persist for the longest time and looks the best?
Among them, structural rhinoplasty can be applied to minimize the drawbacks of 𝐃𝐤𝐫 rhinoplasty and cartilage wrapping, as well as raising the nasal tip, which couldn't be done with the two previous methods I just mentioned. Secondly, structural rhinoplasty will raise the nasal tip without leaving any complications or causing nasal tip perforation. The postoperative results will remain as it is.
Surely, the procedure that brings the best aesthetic outcome is also the most expensive.
Exactly. Korean rhinoplasty costs 10 million Vietnamese dongs. Cartilage wrapping costs 20 million VND. Finally, structural rhinoplasty costs 37 million VND.
Okay, so, once again, the price for Korean rhinoplasty is
10 million Vietnamese dong.
Yes, everyone. Now you know that Korean rhinoplasty costs 10 million Vietnamese dongs, right? Which is equal to the worth of the discount package I mentioned earlier. So, make sure to quickly comment your lucky two-digit number and share this live stream to have a chance to win one of them. Also, we will not accept fake Facebook accounts. Okay, now I will read the questions for Dr. Trai. Someone commented, Dr. Trai, is rhinoplasty painful? Does it lead to any complications?
Korean rhinoplasty, which is the simplest procedure, can lead to nasal tip perforation and redness, as well as implant visibility in the future. On the other hand, cartilage wrapping leaves fewer complications.
Is it true that we only place a silicone implant in for the first method?
Placing the implant in will cause perforation in the future, while cartilage wrapping will reduce the risk of perforation and delay it up to 10 or 20 years. On the other hand, structural rhinoplasty leaves no complications.
And the results can be permanently persisted, right?
Correct.
Is the procedure painful? And how long does the recovery procedure last?
Generally, you only need to administer local anesthesia. After that, rhinoplasty will take an hour, depending on the type of procedure. Technically, it won't be painful, the same as when you get a tattoo. After 10 days, the wound is healed.
Wow, 10 days? Then, will we use local anesthesia or put the patient under general anesthesia for rhinoplasty?
Well, the first and second method requires local anesthesia. But for structural rhinoplasty, the doctor will consider administering general anesthesia, since the procedure can look a bit frightening for patients.
So we will administer local anesthesia for Korean rhinoplasty, right?
Yes.
And general anesthesia is essential for cartilage wrapping.
No, we administer local anesthesia as well for cartilage wrapping.
Oh, yes. Someone asked that if they want to perform rhinoplasty since their noses are flat, do they need to undergo allarplasty as well?
What does it mean for a flat nose? A flat nose means your alar base extends beyond the line that runs down from the inner eye corner to the alar base. In those cases, patients should have the alar base reduced within that line.
We will have a measurement, right, doctor?
Yeah, there is a measurement. We make a straight line that is perpendicular to the alar that runs straight down from the inner eye corners to the alar base. When the alar base extends beyond that line, it means your nose is flat, so you should consider reducing them.
Then, can you share further about the process?
Well, the procedure is called allarplasty. Therefore, we will remove a portion of the tissue, then wrap a thin layer of cartilage there. Finally, sutures are made to reinforce the new shape that makes it look nice.
But if I undergo allarplasty, it will take longer to recover, right?
No, if you only undergo allarplasty, you can be discharged after 2 days and you can put makeup on. Then, it doesn't look like you underwent allarplasty.
Oh, so you will have it done inside.
We have the procedure done outside, but the suture is hidden inside. So when we put on makeup, no one knows that you've undergone allarplasty.
On the other hand, lots of our clients haven't known what procedure best fits them. So, doctor, could you give advice for specific cases?
Now, I will give a brief summary. If someone already has a beautiful nasal tip, but a droopy nasal bridge, there are 2 options. First, filler injection, since fillers work best for the nasal bridge without the need of a surgery, but what are the drawbacks?
We get eczema, right?
You have to get a revision injection once a year because the filler will dissolve and the nasal bridge will gradually become flat. Secondly, filler will enlarge the nasal bridge, making it less slender.
Yes, and after a while, the filler will spread to both sides, right, doctor?
No, it might spread out just after injecting in for a week because it isn't as beautiful as placing an implant in. But, in general, fillers are fine for those who don't prefer surgeries. It is safe, and no one would think the patients have head filler injection. If you choose surgical rhinoplasty, you have to choose your desired nasal shape. One criteria of a beautiful nose is a high nasal tip. First of all, we should measure its length. If the patient's nasal tip is high already, it is unnecessary to raise the nasal tip. However, if the nasal tip is short, the only appropriate option is structural rhinoplasty. Generally, structural rhinoplasty is essential to raise the flat, short nasal tip up, and if your nasal tip already has an adequate length, the patient can choose between Korean rhinoplasty or cartilage wrapping.
Now, let's take an example for our audiences. Do you think my nose can have any further improvement?
Your nose already has a high nasal tip and a straight nasal bridge. Back then, you had filler injection, which makes your nose look gorgeous, even though the filler has dissolved completely. Overall, if you want to lift your nose, it's fine to inject a little filler in, but if you want to raise your nose more according to your desires or favorite trend, you have to undergo structural rhinoplasty.
Yes, about 3 to 7 years ago, people were hesitant to consider facial cosmetic surgery due to the excessive recovery period, complications, and lack of understanding about the procedures. But now, I see that cosmetic surgery has become quite popular, and there are also lots of modern and safe methods, so our ladies can freely beautify themselves without fear, right?
Cosmetic surgeries in general come with their own risks and complications. When you place foreign material into your body, there is always a 1% chance of an allergic reaction. If an allergy reaction occurs, it can cause infection or rejection. In those cases, you have to remove it.
I would like to ask about the complications and allergies. Will it depend on the expertise of the surgeon or the material of the silicone?
Normally, the material is the most important factor. The better the material is, the lower the chance of allergies. But even the world's best material can have a 1% rate of allergies. The rate is low, but if you have an allergy, we can always remove the implant and have a revision rhinoplasty 3 to 6 months later.
But I'm also thinking about the case where we suffer allergies when we place the nasal implant in, then we just repeatedly remove and have revision surgery over and over again. Will it affect the pocket created inside our nose or have any other impact?
Generally, we have to remove the implant on the first time being allergic, then have a revision rhinoplasty after 3 months. We only have revision rhinoplasty when the nose is fully recovered. Secondly, if you still have an allergy the second time, we'll remove it, then place in an autologous cartilage taken from our rib. When using rib cartilage, there will never be an allergy.
So, you mean in cases where our ladies are incapable of performing rhinoplasty, but desire to undergo the procedure at a high price, they can choose to undergo Korean rhinoplasty, which is at only about 10 million VND. But the downside is that they'll have to undergo revision surgeries 2 or 3 years later. For the ones who have better financial conditions, they should undergo cartilage wrapping. And they will look beautiful forever after a single procedure, right, doctor? Another question is that, personally, I see lots of Vietnamese ladies prefer to travel to South Korea to undergo rhinoplasty. Do you think that the quality of post-operative results depends on the surgeon's skills? And what do you think about the skills of the Vietnamese surgeons? Do they have enough qualifications to perform rhinoplasty safely and aesthetically well?
Rhinoplasty in general is one of the procedures that heavily relies on the surgeon's skill sets, followed by their aesthetic preferences. Every surgeon has their own aesthetic preferences. In terms of rhinoplasty, the surgeon's aesthetic preferences and skills are very important. And you're wondering what is the difference between Vietnamese surgeons and Korean surgeons' skills, right?
Exactly. And why do I see that the majority of Vietnamese women travel to South Korea to undergo rhinoplasty nowadays?
In general, You asked how Vietnamese surgeons are compared to the Korean ones, right? I can't tell 4 cases where clients traveled to South Korea, but for me, I have to perform a lot of procedures daily. And I see that clients still highly trust Vietnamese surgeons, and the results are exceptional. Overall, 50% of the plastic surgeries in the Vietnamese entertainment scene are done by me.
Wow, but even though our clients might believe that rhinoplasty in South Korea and abroad will be more beautiful and safer, I believe that Vietnamese people understand Vietnamese beauty standards the best because sometimes Koreans will stick to their own standards, and that might not fit the Vietnamese facial structure. Do you agree?
So do I. And secondly, since you are in the entertainment industry, you know that lots of clients choose South Korea for their rhinoplasty, right? They achieved undesired results and have to travel back to Vietnam for revision surgery. Generally, in Vietnam, it all comes down to personal preferences. Secondly, choosing a reputable surgeon in Vietnam, I think, can achieve the same performance done by Korean surgeons.
Now, if possible, I would love to see you showcase some of the pre- and post-operative photos of the clients you have worked with. Could you ask the staff to bring the photos and so everyone can see?
Sure.
Yes. Now, I will wait for a staff member to bring the images out. In the meantime, don't forget that we will give away 5 discounts in this live stream, with each worth 10 million VND for the 5 luckiest audiences. Let me remind you of the rules. Like and share this live stream, and comment your favorite random 2-digit number in the comments section, as well as tag 5 of your friends, and make sure to complete all the steps I previously mentioned to have a chance to win one of our special prizes. Everyone, at the end of this live stream, we will randomly pick the 5 luckiest numbers. Everyone, please keep actively making questions related to rhinoplasty so that Dr. Trai can fully resolve it for you.
Now, as I mentioned before,
can you please zoom here?
You mentioned earlier about 𝐵𝑢𝑟𝑝lasty, right? Here, take an example of this receptionist's nose, which is kind of flat and droopy. To perform the procedure, we will draw a line from the eye corner to the nasal alar. Then we have to make sure that the postoperative nasal alar lies within that line. The procedure will reduce the nasal alar, and doctors perform it when the congenital ala of nose extends beyond that line. So, firstly, she underwent 𝐵𝑢𝑟𝑝lasty.
Looks really different.
Secondly, the nasal bridge is flat and the nasal tip is upturned. I decided to raise the nasal tip to make it more pointy.
When we raise the nasal tip, it will depend on the
structure.
Using silicone, right?
No, we use ear cartilage or septal cartilage.
So we graft autologous cartilage to raise the nasal tip.
Exactly. When you look at the nose on the side, it looks completely different.
I can see it very clearly. It looks very different compared to the flat nose back then. And a short nose is usually upturned, right?
We will lift the nose if it is a bit upturned, then it will become beautiful. Let's have a look at other photos. There are various types of nose defects. Like here, this client's nose has a dorsal hump on it.
Oh, she is a foreigner.
Yes, a foreigner I worked with. Foreigners' noses usually have a dorsal hump or hooked noses, same for Vietnamese. Therefore, we will reshape it by shaving the dorsal hump and lift the nasal tip. It will become more beautiful.
Shave the nasal bone, right?
Exactly. We will carve the bone, then place a silicone implant inside.
Yes. And is there any other special case that you can show? Like someone who changed drastically compared to the past?
Sure. I'll get 𝐕𝐢𝐿𝐼's photo. Here, this photo belongs to Nguyen. As you can see, she looks totally different before and after the procedure.
Yes, completely different. Normally, I see that clients' nasal tips become pointier after the procedure, right?
That's right. This is 𝐕𝐢𝐿𝐼. Her nasal alar and nasal bridge were pretty flat back then.
She looks totally different, almost unrecognizable.
Usually, a refined nose is made up of a beautiful nasal tip and nasal alar. The tip is often droopy, which makes it look unpleasant. If the nasal alar is excessively flat, they will make the nose look rough. In that case, you will have to refine the tip and reduce the nasal alar to make it more beautiful and pointier. Here, 𝐕𝐿𝐼's nose looks much better after undergoing 𝐵𝑢𝑟𝑝lasty.
Everyone, please actively make questions for this live stream so that me and Dr. Trai can answer all of them for you.
Here, I'll also share this. Now, you might think that fillers can address all types of nasal defects, but it's impossible because fillers only have an impact on the nasal bridge. So remember, if your nasal bridge is flat, it is possible to raise it with filler. But for the nasal tip, you need to have a naturally pointy nasal tip to be able to undergo filler injection. If clients undergo filler injection at unspecialized beauty clinics, there will be risks of nasal tip necrosis, which is extremely dangerous.
Okay, so now we've finished sharing some valuable information about rhinoplasty as well as silicone implants. Now, for the next part, we will discuss the method preferred by many of our clients. But it also contains various complications, and if you can't guess it, it is filler injection, right, doctor? Can you explain more about the filler brands currently available in the market, and which of those are high quality?
Generally, fillers are manufactured in various countries: China, South Korea, Thailand, USA, and European countries. Generally, the fillers that meet the American or European standards are relatively safe, such as the Juvederm brand from the US. Besides being safe, they last longer and dissolve more slowly. However, the cost is about 3 to 5 times higher. But the advantage is that they are safer and the filler can also persist longer. On the other hand, if doctors inject cheap filler brands from China or Thailand, they can cause several reactions, consequences, and complications such as allergies, necrosis, and infections.
It's true that when I surf the net, I see a lot of cases where people prefer saving money, then inject unbranded filler, and not even aware of the doctor's expertise, which leads to various cases of blindness and nasal necrosis, which I find very alarming. So, would you like to share on how our clients can identify high-quality fillers?
When you want to inject filler, firstly, you must know who the performer is. It has to be doctors because only aesthetically trained doctors will know the nasal anatomy, including where blood vessels are, to avoid accidentally injecting the filler into them. For example, if the filler goes into the eye blood vessels, it may cause the eye tail to look like what you have seen, as well as affecting the nasal blood vessels, causing nasal tip necrosis. Therefore, when it comes to filler injections, these doctors are trained to minimize the highest risks of complications during filler injections. But when those complications occur, they will detect and handle them immediately so that nothing serious happens. Therefore, the role of the one injecting the filler must be someone who has received formal training, and the best ones are
cosmetic surgeons, right?
Cosmetic surgeons are the right people to perform. Secondly, when you decide to inject fillers, identify the brand of filler you choose. It is crucial to research online to see the correct name, its manufacturer, as well as all the available information. Therefore, you need to focus on both of these things, and it is a must to verify it online. For example, if you search Juvederm, you will see all the details about it.
Usually, the filler in this tube is used for augmentation, right? So we will inject it into our nose or chin, cheekbones, right, doctor?
Generally, what are fillers used for? To enhance areas that are lacking in volume, such as chin, nose, cheekbones. For such cases, people should undergo filler injection. In general, fillers are augmentation substances used to enhance the areas lacking in volume.
It is possible to inject filler into the nose or chin, right?
For nose injection, it depends on the type of nasal defect. If the nose is medium, a single tube is enough to make the nasal bridge beautiful. Or, for a relatively short chin, a tube is also enough. It depends on one's physiology, but a tube is usually enough due to its high prices. Such as this Juvederm filler, it costs 9 million VND for a tube. But for the Chinese fillers, it will be at only about 1.5 or 2 million VND. But it is unsafe. At our hospitals, we don't use cheap and risky products. We only use American or German brands.
Juvederm is the most expensive brand, right?
Juvederm is the most expensive one, up to 9 million Vietnamese dongs for one tube. And for the Swiss Teoxane filler, it is 7 million VND. Overall, fillers' prices also depend on the manufacturer.
Yeah, and I think that when we choose to either undergo cosmetic surgery or filler injection, we shouldn't choose the unlicensed locations or tacky fillers to save more money. Because it will be dangerous, right?
Extremely dangerous. Firstly, if doctors inject filler from Chinese brands, it will be completely dissolved in about 3 months, while Juvederm takes 2 years to dissolve entirely.
And a lot of times I see the fillers being actually silicone.
The government prohibited that, because once you inject it in, you will have to suffer for being unable to extract it out. For fillers, it will dissolve on its own after 2 years.
But sometimes I see some fillers are made of cheap substances, and they usually clump on our lips or our nose.
That's just silicone, not fillers. If it's fillers, it has to dissolve. Only then, it's fillers. For the fillers we used, it has to be able to dissolve in a year or 2. We don't even mention fillers made of liquefied silicone since they are banned. We only inject high-quality filler to fill the areas that are lacking in volume. If it clumps and doesn't dissolve, then it's silicone. Only real fillers are allowed for injection. Fillers made of liquefied silicone are banned due to various complications from them.
The benefit we received is that we don't have to undergo any invasive surgeries or place anything into our body when undergoing filler injection, right?
True.
Fillers are very quick and convenient, but they're pricey, aren't they? Because we'll have to undergo a revision injection every 6 months or once every year.
It depends on the filler brand. It could last around 6 months to 2 years. Like the best one being Juvederm can last 2 years, but it's expensive.
But for you, how will you consult everyone on which method to use from your perspective?
For me, first of all, it's important to distinguish the condition of a client's nasal tip. If the nasal tip is short, then a rhinoplasty procedure is compulsory to make it more pointy and beautiful. However, if you already have a beautiful tip but a flat bridge, you can choose between undergoing filler injection or a rhinoplasty procedure, depending on you. However, fillers can only address the flat nasal bridge, but not the short nasal tip.
You know, lots of our viewers wondered whether I have undergone any facial procedures. Like, why does our face look different over time? So, today, I would like to confirm that I haven't undergone any facial cosmetic procedures, whether it's Korean rhinoplasty or chin augmentation. Therefore, I had filler injection. But that was a while ago, and it has completely dissolved now. Doctor, do you think that my face looks fine now? Or is there anything else I need to do?
After the revision injection, your face looks very gorgeous, so I think you don't have to undergo anything else.
Everyone usually said that I have undergone rhinoplasty because my nose was very chubby. I weighed 70 kilograms before, so my face looks chubby, causing my nose to not look refined. But now, I have significantly lost weight, so my facial features have become more defined. Furthermore, I also injected some filler to make my nose look better. If you don't prefer filler injection, you can undergo cartilage wrapping to make your nose look better.
Exactly. For the chin, it has its own measurement, so just inject a little to make it more defined.
I see the majority of clients usually use a method where they place a flat surface, like a book, on their nose, and look at it on the side profile, right? We will have 3 contact points.
Divided into 3 points: the lips and chin, the nose, then the forehead.
Here, the nasal tip, lips, and then chin. If these 3 spots touch the flat surface together, then it's fine, isn't it?
No, we will divide the face into the proportion I just mentioned to make the face look symmetrical. For example, if the chin is short, it cannot reach the ideal proportion, which means the chin is lacking in volume. Like from the upper lip to the chin, it has to be 10 centimeters. Same for 𝐃𝐢𝐫𝐿. For some people, the length from the upper lip to the chin is only 8 centimeters. Then perform filler injection so that the chin becomes proportionate. Do you get it?
Okay.
It will be more beautiful when we have equal sections like that.
Doctor, in the case where clients feel like over-injecting filler in their nose or chin, and the filler is also kinda outdated, do we have any way to dissolve it?
There is. We will inject a filler dissolution medication to dissolve it. Like if we see the nose is a bit too pointy after filler injection, we will inject to dissolve it a bit. It's simple and safe. So, if we overdid it or had any complications, we just needed to inject a filler dissolution medication.
Another question I have is that I see lots of places advertising for 5D technology for rhinoplasty, I wonder what those dimensions technologies are like. Could you please explain it, doctor?
There is only a 3D technology for rhinoplasty, and it has always been like that for every aspect of life. Like in a movie theater, we watch a movie in 3D. Then our seat creates effects like shaking. That's called 4D, so there is no such thing. As for D-image technology, if the time element changes, then it's a 4D effect. So therefore, saying there is 4D or 5D technology is not true.
That's only what advertisers call to make it sound appealing.
True, and I believe that it's not the doctors who said so. If that's a doctor, no one would say it's 3D, 4D, or 5D technology. For the actual rhinoplasty, it can be divided into silicone, implant, cartilage wrapping, and structural rhinoplasty. As for the nose, done by a standard 3D image technology, everyone does it. But for the 4D, 5D, 6D, or 10D technologies, etc., beauty clinics only boast about it. Overall, it's all fake, just to scam those who have no clue about it.
Then, I believe that in the cases where people encounter complications such as nasal necrosis, it's because they don't fully understand what they are choosing to undergo. So, if anyone intends to undergo rhinoplasty or any other beauty procedures, I sincerely advise you to thoroughly research it in advance and do not listen to any inaccurate advertising, because sometimes when complications occur, we are the ones bearing it, right?
True, because there are currently lots of inaccurate advertisements online. Don't listen to any appealing lies, but follow the proper standards. And, with more favorable conditions for information research now, you will be able to thoroughly understand the procedures beforehand. For example, everyone uses 3D technology for rhinoplasty now. The 5D, 6D, or 7D technologies are all fake. So, for the locations where they further promote the 5D, 6D technologies, stay away, because those people are the ones who provide inaccurate advertisements.
Let's further discuss the chin augmentation.
Okay?
Actually, regarding chin augmentation or rhinoplasty, would you like to share whether there is any other method for our clients to have a beautiful chin?
Well, it's simple. If you don't prefer surgeries, inject filler. Filler is also capable of filling the chin. But if you don't want to have revisions every 1 or 2 years, you must place a silicone implant in, or you can choose to undergo sliding genioplasty. After cutting a piece of chin bone, the surgeon moves chin bone forward in 𝐃𝐢𝐫𝐿 in a more elongated chin. In general, there are 3 methods for chin augmentation.
Okay, let me see. Just now, when I have a live stream on my fan page, there are also lots of questions. Now, I will also check out the questions on the fan page of Viet Plastic Surgery Hospital, and we will answer them for our viewers. Someone asked, what are the differences between Korean rhinoplasty and S-line rhinoplasty?
S-line is only a common term that people use to refer to the beautiful nose structure. The S shape is what that nose looks like from the side. S-line is a marketing term, so the correct medical name for this method is structural rhinoplasty, which makes the nose longer and increases its projection. The procedure involves using autologous cartilage to raise the nasal tip. On the other hand, Korean rhinoplasty is only used for nasal bridge augmentation.
Yes, it means we use an accurate term, which is structural rhinoplasty.
That's right.
Yes, doctor. There are also many people concerned about breast augmentation consultations, which I think we already mentioned in another live stream we did a month ago. So, everyone, if you have any other concerns about breast augmentation, you can check out the previous live stream session on my fan page. Everyone, please keep making questions in this live stream. And remember that at the end of this live stream, there will be 5 special discount packages, each worth 10 million Vietnam's dong that can be applied for any service at Viet Plastic Surgery Hospital. To have a chance of winning one of our special discount packages, don't forget to leave a like for this live stream as well as comment on a 2-digit number and tag 5 of your friends. And later, we will randomly select our 5 winners. Now, doctor, let's return to the main topic, shall we?
Now, I'm going to briefly summarize everything I just said. First, there are 2 types of rhinoplasty methods, which are non-surgical and surgical methods. For the non-surgical method, we perform filler injection, but it is only suitable for those who have a flat nasal bridge.
And for the ones who had a beautiful nose.
but the nasal bridge is slightly flat, they should undergo filler injection. For the nasal tip that is too droopy, never undergo filler injection because deliberately injecting more will cause necrosis.
Because the skin on the nasal tip is very sensitive.
No. When we inject the filler at the nasal tip, where blood vessels lie, it can block the arteries and cause nasal tip necrosis. Therefore, filler injection is contraindicated for raising the nasal tip. But for those whose tips are excessively flat, a surgical procedure is compulsory. So, there are various procedures in terms of cosmetic surgery, and when you decide to undergo a procedure, you should visit a plastic surgery hospital to receive the best consultation from a doctor. Because a beautiful nose isn't just about the nasal bridge. It's about the combination of the nasal alar and nasal tip. Additionally, if the nasal bone is large, we need to perform a nasal osteotomy.
So, is it a complicated procedure to perform?
No, it's simple.
I've only heard of structural rhinoplasty to make the nose slimmer, but it is the first time ever that I have heard about nasal osteotomy involvement.
For example, your nose and mine are thin, so it's fine. But for some people, it's too large. In that case, we have to reshape the nasal bone to make it thinner.
On both sides of the nasal alar, right?
Exactly on both sides of the nasal alar. When your nasal bone is too large, it still looks unpleasant, even if we place an implant in. Then, we'll have to chisel the nasal alar on both sides to straighten it up and form a beautiful triangle shape. That's the nasal bone shaping method.
Do these procedures have any complications? Is it safe?
It's safe. Like when people fight or have accidents, it's normal to break their nose. We reshape it following the client's preferred shape chosen during the consultation safely and gently. It can quickly recover in just 2 weeks. After a week of stabilization, it's all good.
But what about the method where we carve the nasal bridge, doctor?
That's when there is a hump. If there is a bump on the nasal bridge, we only need to use the diamond nasal rasp to smooth the nasal bridge. Then the hump is gone.
And we will have a vacuum to suck all the bone dust out.
That's right. Also, if the nasal bridge is too flat after it, we will place an implant in. For those who had a high nasal bridge, but with a bump, we just smooth it.
But those who have to undergo that procedure are usually foreigners, right? Since they usually have a hump.
Lots of foreigners have noses with a hump, same for Vietnamese, but at a relatively low rate.
There is Tran Luan, and she asked a great question, which is it okay to have filler injection when I have had an implant placed in?
You shouldn't inject filler if you've already placed an implant in. If you have filler injection, it can only have an impact on the nasal bridge, not the other parts. Furthermore, I wonder what procedure she has undergone.
It means she has used the service of
Korean rhinoplasty.
And now she wants to raise her nose more. Is it okay to perform filler injection?
No, she should get that silicone implant out and place a higher one in. It's simple. If we inject filler in the subcutaneous layer, it isn't good.
It is more complicating.
It's not complicated. It just doesn't follow the designation.
So, if she wants to have an even higher nose after undergoing Korean rhinoplasty, she should remove the silicone implant and place a higher one in.
Immediately, visit the hospital. Doctors will administer local anesthesia to extract the implant out and place a higher one in. It won't be painful or swelling since there is already a pocket there, so it immediately becomes higher and more beautiful.
Yes.
I also would like to share that there are many people who wonder if they can undergo a rhinoplasty immediately after having filler injection. First of all, they were hesitant to undergo a surgery procedure in the beginning, so they opted for filler injection. When they see a slight improvement after the injection, and they want to look even better, they ask if they can undergo rhinoplasty right away. Is it possible? Yes. Just inject filler dissolution medication. And after 2 days, we can perform a rhinoplasty.
But for the cases where they inject low-quality fillers, and the filler dissolution medication doesn't work, it is essential to scrape the filler out, right?
I already mentioned that those fake fillers are made of silicone. If you inject high-quality filler in, we will inject filler dissolution medication to dissolve it. But for the undissolvable filler made of silicone, we have to scrape it out. But it's extremely risky because there will be lots of complications in the future.
I know a few cases where their face became completely distorted after removing the silicone.
Their faces become distorted, and even suffer infections. It is impossible to scrape all of it out, so you must check whether it's silicone first. When talking about augmentation substances, people contraindicate silicone injection. Never inject silicone into your body.
So how do we know if it's silicone or not? Is it listed in the ingredients?
No, there is the name of the brand. Like when people tell you they are injecting Juvederm, then you will surely know it's pure filler. As for silicone, they are unbranded. No brand is granted the permission to produce injectable liquefied silicone, since it is contraindicated worldwide.
I understand. And I see that someone asked about another procedure, which is collagen thread lift. I think we don't do that here at our hospital, right, doctor?
We do perform it here, but it's the same, only able to raise the bridge, not the tip. Collagen thread lift can't bring the same results compared to filler injection. So you shouldn't choose collagen thread lift because it can only persist for 3 months. In general, thread lift is the worst method, since the postoperative results only persist from 3 to 6 months, and the thread is incapable of raising the nasal tip. So, once you have chosen not to undergo a surgical procedure, I advised you to have good quality filler injection. Secondly, remember that no one is allowed to use liquefied silicone, so make sure to check if it's silicone before injecting it in your nose. Some beauty salons or places said that they use artificial fat imported from America or other countries when they are actually injecting liquefied silicone. Never undergo those procedures because it's harmful for you.
Another one asked, "Sis, can you help me with this? I underwent rhinoplasty in Thailand, but now my nose is smaller, so the tip is a bit small. Can I have cartilage wrapping on the nasal tip?"
Sure, we use ear cartilage for cartilage wrapping. It's very easy to have a pointy nasal tip. Just extract the ear cartilage and graft it in the nasal tip.
Yes. And now there are no more questions.
We have answered all your questions. By following these live stream sessions, you will know when to have filler injection or when to undergo structural rhinoplasty. And if you want to do further research, just visit the official website of Viet Plastic Surgery Hospital, where you can find all available information about the rhinoplasty procedures.
Yes, and I'm currently on both my official fan page and Viet Plastic Surgery Hospital's fan page at the same time. I see lots of 2-digit numbers. After this live stream is done, we will select 5 luckiest numbers to be awarded with a discount package worth 10 million VND. After that, we will double check to see whether you've completed all the steps. Give a like, comment, and tag 5 of your friends. If we pick your number but you haven't done all the steps I mentioned, you won't be qualified for the prizes. Make sure to read the captions here and follow all the steps. Should we spin the lucky wheel now?
Yes, we should spin the numbers now so that we can choose and announce the numbers to everyone.
Everyone, it's been 40 minutes into our live stream now, and I also don't want to waste your time more. During the past time, we have had some time together, and Dr. Trai has also shared a lot of his experiences and knowledge in terms of beauty, including various beauty methods. If you want to know how to have a more refined and elegant nose, make sure to rewatch this live stream since it contains various compiled questions and answers. If you haven't been able to catch it, make sure to check out the questions here to have answers to your inquiries. Now, we will proceed to the most exciting part. Spin the wheel to select the 5 luckiest people. Can you please zoom on my phone screen? Can you see it? Okay, I have installed a lucky number spinning app. Now, I will find a lucky number for each time I click. Now, let's make the first spin. Who's gonna be the first lucky one? Pay attention, everyone. 1, 2, 3. 36. Let's see, the first lucky number is 36. Everyone, now I will take note of the first lucky number.
Get me a pen and paper to note it down.
I can just note it down here.
Okay, write it in.
36 is our first lucky number, everyone. Later, I will check if anyone is lucky enough to be able to comment on number 36. If someone has already commented, I will check all the steps again to see if you have completed all the steps. Moving on. Our second lucky number is 44.
Wait, 83?
Oh, it's 83. I'm sorry. It hasn't finished spinning. So, our second lucky number is 83. We continue with the third number. Number 22. Has anyone commented on 22? Okay, I will note it down. Okay, only 2 numbers left. I wonder which numbers will they be. I will let Dr. Trai spin this time.
Just spin it. I don't know how to do this.
You can just press it here, this random word.
Okay, number 35.
35. Now, coming to our final lucky number. 75. Okay, that's 5 lucky numbers. Now, I would like to repeat the 5 lucky numbers, which are 36, 83, 22, 35, and 75. Make sure to check if you have one of these numbers. Everyone, if you have one of these numbers, please comment down below so that we can double check to see if you've done all the steps. Okay, that is the end of our live stream. Thank you so much, everyone, for spending your time listening to valuable knowledge about rhinoplasty procedures from Dr. Trai. There will definitely be more live stream sessions in the future, and I hope that everyone will continue to join us. Doctor, do you have anything else to share with everyone?
As I said, if you still have any other concerns after this session, visit the official website of 𝐕𝐢𝐴 or contact us via phone calls for more detailed consultations. Or, if you have favorable conditions, visit our hospital for a consultation, so our doctors can advise on what kind of nose is the most suitable for each of our clients.
And I honestly think that if everyone has time, make sure to visit Viet Plastic Surgery Hospital so that our team of doctors and nurses can advise on what is the best and most beautiful method for you, because here there are lots of beautiful staff members as well as a team of highly experienced, skilled, and very enthusiastic doctors and nurses, so feel free to come here. Now, we will say goodbye and see you in the next live stream sessions. Everyone, thank you so much.
Tell them whoever wins the prizes. Inform us via SMS to receive them.
If anyone hasn't been able to see where I announce the prizes, please rewatch this live stream to see whether you have commented on one of the 5 lucky numbers. If you did, comment down below, and I will double check to send the 5 discount packages, each worth 10 million VND, and you can apply for any service at Viet Plastic Surgery Hospital. Goodbye. See you in the next live stream session. Thank you so much, everyone.